A hearty good afternoon and welcome to a session on eating right supplements in pregnancy. We're glad to have Dr. Chandana Galidevara among us today to help us explore this topic. Supplements are specially formulated to meet the rising demands for nutrition. But there are a few supplements that should be taken by expecting moms to give their bodies the vitamins and minerals they need for a healthy pregnancy. Taking the right supplements help us ensure that your baby gets the right nutrients, and it also helps you with a healthy and a happy life during your crucial times. The doctor will take us through this and help us understand this better. Doctor, you have the stage.
Thank you. Good afternoon, everyone. And we are celebrating the National Nutritional Week today. I will be taking you through what important supplements need to be taken in pregnancy. I am Dr. Chandana, consultant gynecologist in Apollo Cradle, Kondapur. So, eating well in pregnancy is very important because the mother has to eat for herself as well as for the baby. But there is a misconception that you have to eat for two. So it's not basically eating for two. That doesn't mean that her calorie requirements double and all the nutrients requirement double. There is a cutoff for everything. So eating too much is also bad, and eating too less is also bad. Having a healthy balanced diet is very important so that the mother gains optimum weight gain in pregnancy, as well as the baby has a good size at the time of delivery. So, talking about what supplements to take in pregnancy, we have a list of vitamins and minerals which need to be taken. First, I will talk you through about the vitamins and the minerals, and after that, we'll discuss about what kind of food, how to divide the food and eat. And also, in the end, I would also tell you that what needs to be avoided in pregnancy in the foods, the kind of foods which you need to stay away from. So, coming to the supplements in pregnancy, the first and foremost and most important, and the supplement we start when a woman becomes pregnant is folate or folic acid. So, folic acid is a B complex vitamin, and its importance lies in the fact that it helps in preventing birth defects to the fetus. So birth defects can be anything, but mainly it prevents development of defects to the brain and the nervous tissue. But it also helps preventing the other birth defects like cardiac malformation, cleft lips, and palates. But mainly it is confined to preventing the defects related to the brain and the nervous tissue. How much folate is to be supplemented in pregnancy is the next question. So we need to take 400 micrograms of folic acid. Most of it comes in the form of diet, but sometimes if the diet is not adequate, we need to supplement it. So as a general measure, we advise all women who are planning conception, because if this vitamin is adequate right in the preconception period, the chance of baby having birth defects becomes less. So, right in the preconception period, 1 month ahead of conceiving, if the folate levels are adequate, it is good for the baby. And the amount we need to recommend is 400 micrograms in a healthy pregnant woman and a woman who doesn't have any high risk factors. But if a woman has high risk factors, then the amount of folic acid is 4 milligram. So, what are the high risk factors which we need to watch out for? Any woman who's diabetic, a woman who had previous birth defects, or any kind of neural tube defects or brain defects in the baby in the previous pregnancy, any history of epilepsy in the mother, epilepsy or seizures, and any history of any family history of birth defects or brain defects or neural tube defects. There are certain brain defects and spinal defects which can run in families. So if any of these factors are present, then the mother has to take 4 to 5 milligrams of folate. The next important supplement which we need to watch out for is calcium. So, calcium, ideally, most of the calcium comes from milk, eggs, poultry, and green leafy vegetables. But sometimes, again, calcium, the requirement is around 1 gram in pregnancy. So women may not have enough calcium in their diet. So we supplement it from outside. Now, the next vitamin which is important in pregnancy is iron. So everybody knows that we give iron tablets, and but iron has its own effects. It does cause some amount of nausea, vomiting, and it triggers gastritis. So generally, we start iron a little bit later after the third trimester, third month is over, and the woman does have a lightening of symptoms, the nausea, vomiting settles, then we start the iron supplementation. And according to recommendation, the iron, the requirement is 30 milligram, but what we need to give the woman is a minimum of 60 milligram elemental iron. So where is this iron found? Iron is found in green leafy vegetables, drumsticks, almonds, dates, and cabbage, eggs, milk, and also meat. So lean meats, red meat contain a lot of iron. We don't recommend red meat in pregnancy, but yes, lean meats are recommended in pregnancy. And also dates contain a lot of iron. So does dry fruits. So all these in healthy portions, if the mother can take it, then her iron requirement from the diet to some extent is achieved, and the rest we supplement by giving the tablets. So generally the tablets which we give are iron tablets which contain 60 to 100 milligram elemental iron. So that's about the element called iron. The next supplement, which is very important in pregnancy, is iodine. We tend to forget about it. And it is not a supplement which is usually given in the form of a tablet, but it is essential that it comes in adequate quantities through the diet we take. So, diet rich in iodine means that it's better to use iodized salt, and the flour, wheat flour, can be fortified with iodine. There are some kinds of wheat flour which is fortified with iodine, so you can take that. And also, fish and seafood contain lots of iodine. So, iodine is related to the thyroid issues in pregnancy. So, whenever there is a deficiency of iodine, the mother can have goiter or hypothyroidism in pregnancy. And hypothyroidism has its own ramifications in the fetus, where the baby can have baby per se can have hypothyroidism, or the baby can go into a premature or preterm labor. So these things can be prevented by making sure that you take a diet which is having good quantities of iodine as well. So these are the main supplements, but there are some other micronutrients as well which are important. Coming to omega-3 fatty acids. So these are essential fatty acids which help in the brain development for the baby. So the brain is made up of a lot of fatty acids, and if the woman takes these polyunsaturated fatty acids in the right quantities, that helps in the baby's brain development. So most important component which we stress upon is having DHA, which is called as the docosahexaenoic acid. This is a essential fatty acid, and adequate quantities of this is related to the brain growth of the baby. Generally, this can be taken in the form of supplements. So we do get tablets which have a combination of folate and DHA, or sometimes DHA can be present in the protein powders which are prescribed in pregnancy so that the mother gains weight. So it can be combined with the protein powder or with any of the multivitamins. It can be also taken as capsules. So some people have this habit of taking fish oil capsule, but you need to check how much of quantities of other essential fatty acids are there, because too much of fatty acids is also not recommended. So just the right amount of DHA, which is found in either the protein powders or the multivitamin supplements. Along with that, you can take a good quantity of nuts, raisins, and seafood. So fish, 2 to 3 helpings a week, So that will make sure that you're having adequate amount of omega 3 fatty acids. For people who do not take the seafood and who are strictly vegetarians, you can go for the supplements. Now, that is about the essential fatty acids. Coming to the other vitamins, an important vitamin which is usually overlooked is vitamin D and vitamin B12. So, vitamin D is required right from the beginning of the pregnancy, just like how folic acid is required. Vitamin D is also required, but in very small quantities. You don't have to take any high dose vitamin D concentrated capsules. All you need to take is a 10 microgram or a 600 international units of vitamin D. So generally we do have the vitamin D as a combination with the calcium tablet. So when you take that in pregnancy, your vitamin D requirement as well as calcium requirement is covered. Otherwise, vitamin D is also present in food. So, food which is rich in vitamin D, like green leafy vegetables, nuts, raisins, flax seeds, all these things, and also the seafood and meat can be taken. And it is called the sunshine vitamin. So, basically, some exposure to sunlight every day also helps. So that's about vitamin D. Coming to vitamin B12 is another important vitamin. It need not be specifically supplemented in pregnancy because most of the time, the diet, if you take a balanced diet, it is covered in the diet. But sometimes people who are strictly vegetarians again might have a deficiency of vitamin B12. So in that case, it can be combined with any of the supplement capsules. You can either combine it with a folate capsule or any other B complex capsules and take it. So that's about the supplements in pregnancy. There are a couple of supplements like choline, selenium, etc., zinc, which need not be specifically supplemented in the food. If you take a balanced diet which contains enough quantities of proteins and carbs and fatty acids, that will contain the essential micronutrients in the right quantities. So that should suffice. Now, coming to how should you plan your diet in pregnancy? So, when you're planning your diet, it is divided into five components. You need to include these five things when you're doing a meal plan. One is having grains. So, grains includes cereals, whole grains where the kernel or the husk is not removed, are supposed to be better and more nutrient rich compared to refined grains or refined flour. So take grains or cereals which contain the husk or the kernel. So whole grains are much better. You can take oats, ragi, whole bread, whole wheat, um, brown rice, red rice, etc. Then comes after grains, then comes the vegetables. So you need to take a good servings of vegetables, include all kinds of green leafy vegetables and colored vegetables. We have spinach, broccoli, carrots, tomatoes. So all these can be included in the meal planning. You can take salads in the evening for snacks. And the third thing are the fruits. So fruits are very important in pregnancy because of two reasons. One, it contains a lot of dietary fibers which help in relieving the constipation which happens in pregnancy. The other thing is fruits are rich in potassium. So whenever there is some kind of electrolyte imbalance, if you have fruit juice, it does correct the electrolyte imbalance to an extent. So fruits, take a good serving of 3 to 4 servings of fruits every day. You can include seasonal fruits. So fruits such as apples, oranges, guavas, and all the seasonal fruits like lychee, all that can be included in your diet. Then after fruits, the next important component in the diet are dairy products. So what dairy products to take? Dairy products generally, we don't think of anything other than milk. So it's just not milk. You can also have buttermilk, curd, yogurt, cheese, butter. etc., ghee. So you can take dairy products in different forms, but make sure that when you do a diet planning, all these are in the right quantities and nothing dominates the plate. It should not be that the cereals are dominating and there is a deficiency of vegetables, or you take only vegetables and totally avoid the fruits. So that kind of things need to be avoided. So that's about how you plan your meals. So make sure that you include whole grains, fruits, vegetables, um, dairy products, and a good amount of dry fruits also. So dry fruits, raisins, almonds, walnuts, all that can be included. Dates are rich in iron content, so make sure that you include that. Next thing is taking enough amount of fluids. So fluids, it's very important that you drink at least 8 cups of water every day. So 8 cups of water will lead to going to the washroom very frequently, you might think. And there are people who compromise on taking enough fluids, but that should not happen, because there is a chance of getting urine infection in pregnancy if you end up having dehydration or have poor water intake. So please take enough water and also other fluids. You can take WHO ORS solutions. You can also take lemon juice if you're able to tolerate it. You can take fluids, different kinds of fruit juices, coconut water. All that can be taken in pregnancy, and it makes sure that your hydration is well maintained. And also, if you take the fruit juices, your electrolyte balance is quite maintained. So that's about the fluids in pregnancy. So this is how you plan your meal. So make sure that you have enough quantities of proteins, carbohydrates, micronutrients, like vitamins and minerals. Take enough quantities of essential fatty acids and fluids whenever you are going for a meal planning. The next thing what I wanted to tell you in the end is what foods to avoid in pregnancy. So not many foods you need to avoid per se, but there are a couple of things like bacteria like listeriosis, which can cause miscarriage or stillbirth. And there are parasites like toxoplasma, which can also cause adverse pregnancy outcomes. So you need to avoid foods which can be infected with this kind of organisms. So ideally, a milk which is raw and unpasteurized, which is not heated or treated with pasteurization method, is supposed to be avoided in pregnancy, mainly because it has a chance of spreading the bacteria called listeria, and listeria can predispose to stillbirths and miscarriages. So this needs to be prevented. You can take all the milk you want, but make sure that it is from a pasteurized source. The next thing you need to avoid is any raw or undercooked meat. So when we talk about raw or undercooked meat, it's not very common in our country to have this kind of meat, but sometimes in the form of sausages, chicken salamis or pepperonis, it can find its way into our diet. So make sure that when you take um, this kind of meat, we're not sure whether it is cooked well or heated well. If it is an undercooked or raw meat, it can harbor toxoplasma parasites, which again can lead to adverse pregnancy outcomes. So make sure that whenever you have any kind of meat, it is properly cooked. The next thing which you need to look for is taking soft cheese. It's okay to take hard cheese, but soft cheese such as camembert, brie, all these soft cheeses, they retain a lot of moisture. They absorb moisture. So whenever cheese absorbs moisture, it becomes a very good medium for bacteria and other organisms to grow on it. So when you take soft cheeses, you need to be very careful. It's better to avoid any kind of soft cheese like camembert, etc. But you can have all the hard cheese. The next thing you need to avoid, make sure you avoid, is vitamin A, excess vitamin A. Vitamin A in some quantities is important in pregnancy, but excess of vitamin A is not safe to the baby. It can cause, in the early stages, it can cause some kind of birth defects in the baby. So if somebody is on treatment for especially acne, you tend to have vitamin A supplements. So you need to watch out for it. If you're on vitamin A supplements, you need to stop them abruptly and consult your doctor. Any vitamin A excess food is found in this animal liver. So if somebody has a tendency to eat too much of animal liver, you can have excess of vitamin A, which is again not good for the pregnancy. Liver is good because it's a source of iron and other components, but when you have it in excess, it is definitely going to be bad. So better that you have a control over having this kind of food. The other thing which I wanted to tell you is to make sure that whenever you eat food from outside, you need to make sure that it is a properly cooked food. Sometimes we do have food which is undercooked, and things like chaat, etc., are not even cooked. So they are just mixed with hands or fingers. So when you eat this kind of food, you need to be careful because this can lead to food poisoning, which will have consequences in pregnancy, leading to indigestion or infection, diarrhea, and vomiting. So when you are taking food from outside, you always make sure that you take food which is heated and cooked and not something which is ready made, instant, and undercooked. So that's about what to avoid in pregnancy. The other important things you need to avoid are caffeine. Excess caffeine is bad for health. So people who have the habit of drinking 2-3 mugs of coffee every day, you need to watch out for that, because the caffeine limit in pregnancy is should never exceed more than 200 milligram. So that means that if you have one filter coffee, that itself contains 140 milligrams of caffeine. So you cannot have a second full cup. So 2 cups of normal coffee is usually 200 milligram. So it's always better to keep your caffeine intake lesser than that and never more than that. So never have like 3-4 cups of coffee because you're used to it in the preconception period. And always avoid alcohol. Alcohol causes a lot of adverse effects. Again, when the baby is in the conception stage and also in the organ formation stage, alcohol has a tendency to cause malformations in the baby. And also in the later stages, it can have an effect on the nervous system development. So it's better to avoid alcohol, smoking, and excess caffeine. Too many herbal supplements and herbal teas also you need to watch out for. Herbal teas, 1 to 2 cups is all right, but if it is excess, then you need to check how much of caffeine it contains, and what other ingredients it contains, because sometimes it may not be really good for the baby. But even herbal teas do contain some amount of caffeine, so it's not like they are fully safe. You need to have a check over the caffeine limit when you're taking herbal teas. So that's about what food you need to be careful and watch out for in pregnancy, and the kind of meal planning you need to do. I have already discussed, and so if you make sure that you include all these points whenever you plan your diet, it is helpful for you. So thank you, and any doubts, I'm ready to clarify.